Did you know that less than 15% of all patients follow doctor's orders? What does that mean? Most patients don't take the prescriptions as directed. Research has shown us that years ago. If you look at the work by Maguire for patients who have periodontal therapy, about 15 to 16% get their teeth cleaned every 3 months after periodontal therapy. Well, we know that maintenance is probably the most important phase of periodontal therapy. If you look at 3 groups of patients, as Neiman and groups did back in the 70s in Gothenburg, Sweden, what we found was that the patients that were coming back every 3 months following periodontal therapy did better than patients that got no periodontal therapy whatsoever, or patients that had surgery and did not have any recall. So what does that mean? Doing surgery without recare is worse than doing no treatment. Doing surgery without doing recare is worse than doing no treatment. So the most important phase of treatment, most likely, is getting patients on a 3-month recall program. Knowing that, what I've done is I have now incorporated a strategy that was taught to me by P.D. Miller. P.D. Miller, the father of periodontal plastic surgery, said to me a number of years ago, "Are you going to write an article?" And I go, "Yes, I will." He goes, "I want you to write an article on this topic." And it was a topic he saw me lecture on. I said I'd do it, knowing that I might or I might not. I didn't make a commitment. Well, about 4 months later, on a Sunday morning, P.D. Miller calls me up. He's 80 years old at the time. I'm 60. And he says, "Mike, how's the article coming?" I go, "It's coming okay," knowing that it wasn't being done. He says, "I'd like you to commit to getting it done." I go, "Okay, I commit to getting it done." And what he said to me was, "I want you to say, I, Dr. Michael Sadek, commit to Dr. P.D. Miller to write this article by this date." And he made me go through all of the machinations of writing that out or speaking it to him, which I did. And about a month later, the article was written, and today it's published. It was an article that I wrote on anterior aesthetics. That article wouldn't have been published as timely if I didn't make the commitment. Okay, all forward motion starts with telling the truth. But without a commitment to doing it, I'm not going to move anywhere, nor will my patients. If I talk about Dan Sullivan, he talks about the 4 C's. Commitment, the courage to make that commitment, the competency that comes, and the capability that comes to get that. He talks about the 4 C's. It all starts with the first C, which is commitment. All forward motion starts with telling the truth and making a commitment to doing it. Nothing in your life or my life gets done unless I commit to doing it. So, how does that refer back to periodontal care? Most periodontists, most dentists don't talk about long-term care and maintenance to their patients. It's just a fact. Maintenance, however, in my opinion, is the most important phase of periodontal treatment. It's the most important phase of any treatment. Keeping my house in order, keeping my car in order. Without maintenance, it doesn't take very long before the car to fail or the house to look like it's disheveled or whatever. So knowing that, I want to get my patients to come back for recall. Why? Because it's the most important phase of treatment to keeping their teeth long-term because it controls disease. It's not the surgery that controls it 10 years from now. It's the routine maintenance at home and in a dental office. So at the initial visit, after I present the treatment plan, I say, "This is the treatment plan we're going to do, but I need your commitment." They go, "Okay, what is that?" "I want you to commit to getting your teeth cleaned every 3 months. Can you do that?" And sometimes they say yes, sometimes they say no, but it doesn't matter what they say. I will explain to them the importance of long-term care and what the data shows us. And then I'll get them to say with the same thing P.D. Miller said to me. "I, John Smith, commit to you, Dr. Michael Sadek, to get my teeth cleaned every 3 months for the rest of my life after I go through periodontal care." Now, it sounds silly, especially when I say it to a 65 or 70-year-old man who's a CEO of a corporation to commit to me to getting their teeth cleaned every 3 months. But if I don't do it, who's going to get them to do it? Isn't that our responsibility as healthcare providers to tell patients exactly what they need to do to keep their teeth long-term and what they need to do to keep their mouths healthy? Do cardiovascular surgeons say to patients before they do bypass surgery, you got to cut out fats, you got to start on an exercise program, you got to do HIIT training, you got to get 8 hours of sleep, you got to drink 8 glasses of water a day, you got to do meditation, you got to do yoga? No, they don't tell them all that. They say take the medications. Most people don't have a program for that. Yeah, you'll get 6 weeks maybe in rehab, maybe you'll show up for a week or 2, but most people do not do the things that are necessary to keep themselves healthy for a long period of time. It's our responsibility to tell everybody all that they need to know so that they make the right decisions for their own lives. Isn't that what we're trained to do? No, we're not trained to do that. That's why most doctors don't do it. So consider doing the commitment speech to your patients. It's in their benefit. It shows that you care for them and you're being honest with them. And isn't that what we're doing? Isn't that the most important thing? To be honest, open with our patients, so they can keep their teeth for years to come. Be the gift, everybody. Tell your patients about the importance of long-term care.